Here we go.
Hi,
Hi, everyone. It's Alison Greenberg, co-founder and CEO of Ruth Health. We are the telehealth hub for perinatal care and resources. And I'm joined today by a fellow Y Combinator founder, female founder. We're celebrating International Women's Day today on March 8th, 2022. Dr. Sipra Laddha of LunaJoy. Thank you for joining, Sipra, and please feel free to give yourself a quick intro and let us know about LunaJoy.
Sure, really happy to be here. So I'm Sipra Laddha. I'm a physician that specializes in perinatal mental health, so women's mental health, pregnancy, postpartum. I'm joining from Atlanta, Georgia, and I'm also CEO and co-founder of LunaJoy. LunaJoy is a women's mental health platform where we offer medication management, therapy, coaching, and genetic testing for women throughout the lifespan, so anywhere from adolescence through pregnancy, through perimenopause, menopause, and beyond. We're currently available in 11 states, do all of our appointments via telemedicine, and in addition to cash pay, we're in network with a large number of insurances now, so we're really looking to open up access to mental health for women across the country.
Awesome. Yeah, and that is so exciting to hear that you are in network. It's definitely going to move the needle for a lot of folks. Today, we're really kind of joining forces to talk about the interconnectedness between perinatal mental and physical health. It's a perfect conversation for us because at Ruth Health, we're really taking care of the physical. At LunaJoy, they're taking care of the mental, emotional, and social. And so, at Ruth Health, we're mostly focused on taking care of breast, pelvic, and abdominal care. And we're really formatted for working moms. So these are a lot of folks who are, living their lives, running their careers. Pregnancy is just a part of that. The world can't stop for it. But I want to bring up a couple of pieces of evidence because being evidence-based is really critical to who we are. And I know also to who you are at LunaJoy. Mm-hmm. So the first thing I want to bring up is the incidence of traumatic births. And I know Dr. Sipra had brought up her interest in how birth modality affects mental health. I have a lot of interest in this because of looking at a 2019 study in the journal Reproductive Health, where 1 out of 6 women reported being mistreated during labor. So the sort of sentiment quoted was loss of autonomy, being shouted at or scolded, being ignored or refused. And then we know that birth modality can have an even greater effect there, whether it's an emergency C-section, an assisted vaginal delivery. What have you seen really has a lasting effect when it comes to those birth modalities?
Yeah, and so I think there's really 2 components to this. One is the woman's journey through pregnancy and postpartum, the birth specifically in terms of how she's treated, how much respect she's given, what sort of say and autonomy she has in her experience giving birth. And, that's kind of a complicated thing because there's so many things that are influencing that space, especially if, the woman is delivering in the hospital where there's competing interests with staff, with physicians, with safety, and with what the mom herself wants. And especially as our healthcare systems become more and more burdened, mom's voice is often lost, and it can be an incredibly difficult experience to go into the hospital, expect to give birth, have a vision of what it's supposed to look like, and a very clear idea of what you do and don't want. And then in the moment, and these are often quick moments, quick decisions that are made due to a number of factors in the moment that can be really not respected, not heard, and sets people up for a lot of disappointment. And it's a really hard time to have disappointment. It can be traumatic, there can be disappointment. And then there's also the other part of it, the physical part, which is I think where we are really intersecting here, which is sometimes intervention is needed, right? Sometimes a C-section is needed. Sometimes an emergency C-section is needed. Sometimes there's what we call like vaginal instrumentation or an assisted birth where forceps are used. And all of those things, actually, I'm glad that we're finally starting to look at it, but all of those things not only have a huge implication on the physical recovery postpartum, right? There might be a bad tear or a scar that's healing, but really also how the woman feels and how depressive symptoms and anxiety symptoms might manifest in the postpartum period. In 2019, they looked at just under 700 women that were about 3 months postpartum. And they found that women who had C-sections and assisted vaginal deliveries, so forceps and vacuum deliveries, were much more likely to have somatization issues, to have postpartum OCD, postpartum depression, postpartum anxiety. And that number really like tripled if it was an unplanned C-section.
Yeah, it really speaks to this idea of increasing invasiveness in the pregnancy. It is more mentally invasive. And I think to your point, the fact that there's so many unknowns, this is why we're huge fans of doulas. It's great to have an advocate in the delivery room and along the way for your entire perinatal journey. Doulas are hands off. They're considered non-clinical providers when it comes to birth work, but they can often help advocate for the patient. They can advocate for the birthing person and really try to prevent something that wasn't in the plan from happening, unless it is an emergency situation. So I'd love to continue to explore some of the intersections between experiences during prenatal and postpartum and the incidence of things like depression and anxiety. So one study that I found really fascinating came from Frontiers in Global Women's Health. It's a September 2020 study. And basically what this study found was that the literature is not clear, it's not decisive around breastfeeding. It feels like this is a constant thread in maternal mental health and physical health. We just don't have enough research. But in the field of breastfeeding and looking at its intersections with mental health, there were several studies demonstrating that breastfeeding is protective for the onset of anxiety or depression. Then there's a study showing that the difficulties related to breastfeeding can actually make the incidence or severity of psychiatric illness in maternal and that sort of perinatal period worse. And then there's several studies demonstrating the negative impact on depression on the duration of breastfeeding. There's some showing that postpartum mental illness could emerge as a consequence of early interruption of breastfeeding. So it feels like a lot of this feeds into that sort of damaging notion of breast is best. Do you see with your patients and then with the folks at Luna Joy that breastfeeding can become a source of significant anxiety?
Absolutely. I think, the conflicting information that all of these studies provide really highlights a key important factor here with breastfeeding, which is it is incredibly personal and personalized. And just in general in psychiatry, when we think about mental health, it's really important that we're taking a personalized approach, because what might be protective for one mom is really going to be disruptive for another mom. And so there's benefits to breastfeeding. There's also benefits to getting what we call like blocks and chunks of sleep for women. So, one of the proactive things that we can do if someone is already struggling with depression, anxiety, or we know that they're going to be at high risk, is to get 5-hour chunks and blocks of sleep. That is the number one most protective thing that we can do. And so, that's something that potentially could interfere with the breastfeeding relationship. And so I think the way of thinking about this is that there is no one ideal. And I really like the idea of inclusive breastfeeding, which is if it works for you and it's helping your mental health and it's working with your infant dynamic, then it's absolutely protective. If it's getting in the way of, getting consolidated sleep, if it's getting in the way of feeling better, if it's getting in the way of experiencing that postpartum period the way that you want to experience it, then consider other options. And breastfeeding also doesn't have to be all or nothing. I do think that in our society, we're really polarized. Breast is best, fed is best. But actually, the way most life works is that some of everything might be good. And so I think anything that we can do to help not only healthcare practitioners, moms themselves, their support systems feel really flexible about what happens is what's going to be most protective in terms of perinatal mental health.
Yeah, I love that point, because I think with our, virtual lactation support, all of our lactation consultants and certified breastfeeding specialists do believe that fed is best. Exclusive breastfeeding is incredibly hard to do. It's incredibly time consuming. It's oftentimes not possible if you're breast or chest feeding and going back to work. So having that flexibility is key. And also remembering, if you're not exclusively breastfeeding, you're not able to use breastfeeding as a means of birth control. So, Now we have to think about the mental impact of new hormones and potentially bringing in a postpartum birth control option. So it's a multi-variable equation.
Yeah.
Another study that I wanted to bring up that I just think is so fascinating. I know I've talked about this with Sipra before, but the research, particularly on pelvic disorders and mental health, is not very robust in the US. But then we go to Saudi Arabia, and there's a pretty powerful study from the International Journal of Women's Health, 100 women diagnosed with pelvic floor disorders. And what we're looking at is that those with those disorders exhibited a 3-fold higher prevalence of depression symptoms than the controls. So we're seeing there's this significant association between pelvic floor disorder and depression. Quality of life scores are significantly lower in those patients who had pelvic floor disorders and depression. Why do we think it's so hard to find research like this coming from the US?
Well, I think the bigger picture is, and this is, my personal take, is that there's so much suffering for women that's normalized. If we really think about how much the pelvic floor is doing in terms of our limb girdle stability, in terms of being able to go to the bathroom every day and stand up straight every day, and all the things that the pelvic floor is holding in place and all the different functions, and we think about that being disrupted, I think this really highlights the absolute link between physical and mental health. I know that in our society, we like to treat them as two different things, but if you have pain, if you have instability, if you feel that you can't do certain things, if you're worried about peeing in your pants, that has profound psychological implications. And if there's already maybe some depressive symptoms there or some genetic vulnerability, then we get depressive symptoms, right? We get depression, we get anxiety. And in terms of, why this isn't studied, I think that this is a bigger question. And I think it does really go back to that there's so much that's normalized for women as something that you just bear and grin. And that's getting really old. We need to be studying these things. And in a lot of cases, and I'm sure that you have seen in the work that Ruth Health is doing, there's solutions. There are identifiable solutions. There's treatment that is very effective. It's a matter of kind of connecting the dots and getting people into the care that they could really benefit from.
Yeah, absolutely. And I mean, we're studying the impact of our own services right now. Everything you're talking about is a huge reason why we developed pelvic training and recovery that you can do via telehealth. There's an incredible range of exercises rooted in Pilates, diaphragmatic breathing. Our one-on-one sessions are really focused on finding a customized solution and then creating a care plan. And by doing those exercises, you're not only helping to strengthen the pelvic floor, you're giving yourself the same positive feeling as, going to the gym or doing a yoga class and feeling like you're contributing back to yourself and doing that self-care. But then it goes back to what you're saying about society's normalization of incontinence. We always talk about how many times have you heard an auntie or a grandmother or a mother say, oh, like I pee in my pants a little bit when I laugh or when I sneeze or when I jump. That's not normal. That's not how it's supposed to be. And if we go to a country like France or Saudi Arabia, pelvic floor physical therapy is standard of care. So we know that this is just something we have to sort of denormalize in the US. And then we have to include it in our daily conversations and not make jokes about something that really does damage quality of life.
And on the flip side of that, in mental health, I think that there does need to be more of an emphasis on the unique journey that a person might be going through as they go through the birthing process. Right now, it is not standard of care in most psychotherapy appointments or even medication management appointments, even for postpartum women, to ask, what was your birth mode? How did that happen? How are you healing? Did you have a vaginal tear? Have you had a C-section? There's so much just, okay, you got handed a healthy baby, and so that must be fine. There's no emphasis at all on the physical health. We don't even see a lot of women until 6 weeks postpartum, at which point we're assessing for their mental health and we're assuming that they must be physically healed in, every way imaginable. And that's it. They're not coming back for another year. So I think even in our mental health appointments, one of the big focuses at Luna Joy is that all of our providers are asking specifically about things like birth mortality. They're asking specifically about what that journey was like through pregnancy, how they felt when they delivered, how they felt about their hospital course, how they felt the first couple of days and weeks when they were home, because we know that all of that is really valuable information that's just skipped.
Yeah, that's so awesome that you are asking about that and bringing it to the fore. I think not just for patients to be heard, but for data to be collected,
Mhm.
so that we can actually start to understand the population health aspect of these things, of birth modalities, and of why maternal mental health lands where it does.
Mhm.
The stat that I often see is 1 in 5 mothers or birthing people experience PMADs, perinatal mood and anxiety disorders. That stat gives us no color. It gives us no understanding of the why.
Yeah.
So it's great to hear that you all are really digging into those causations and just sort of sequelae.
Yeah. And not only does that stat give us no color as to why, but also that is like a really, really likely underestimate of what's actually going on out there. So 1 in 4 to 1 in 5 women are reporting mood disorders or perinatal mood disorders. But what we know is we're not uniformly screening. We're checking in kind of once postpartum with often a quick 10-question screen that really only looks at depression, doesn't look at anxiety. And so really the numbers I think that we have are vastly underestimating how much, mental health difficulty there is in that time setting. So we need to
Yeah,
do a better job screening too
absolutely.
and picking that.
Absolutely. And I have faith that you all are doing a better job at Luna Joy. Okay, last question. And this is just something that personally irks me. I cannot stand when I hear this. But I think it's something that women do normalize for themselves, the phrase mommy brain. So it's oftentimes something that, could be connected to brain fog, could be connected to, shifting hormones, and the fact that while you're pregnant and immediately postpartum, things are really in flux when it comes to your, mental stability, your mental health, and especially those hormone levels. But is this a tendency to be self-deprecating, or do we actually have science to ground the idea of mommy brain?
I think this is kind of goes back to what I was talking about earlier, which is this is the tendency to normalize things that are not normal. Sure, with a combination of change in hormones and sleep deprivation and the, huge shifts in like the social role in the household and things like that, there's absolutely less attention and detail that is spent on things that are not immediately, of concern. But I hear mommy brain that goes on for a very long time that is actually, some form of depression or anxiety or perfectionism or something else, which is actually a problem, which is, something that can be worked on through treatment, whether that's therapy or the various modalities of treatment. And so I too do not like that term, because I think it is this umbrella that we use to push a lot of stuff that is not normal under, and again, like normalize things that don't need to happen and don't need to be part of that postpartum journey.
Yeah, here. Well, with that, I know it's been a short, but I think really pithy conversation. I want to thank you so much, Dr. Sipra Laddha, CEO and co-founder of Luna Joy. Anybody who's interested in checking out mental care that is really designed for women and birthing people, check out hellolunajoy.com. And I'm Alison Greenberg, again, co-founder and CEO of Ruth Health. We're at ruthhealth.com, and we are the telehealth hub for perinatal care. So thank you so much, Dr. Laddha, and hope you have a great day.
Thanks, you too.
And happy International Women's Day.